afternoon. My name is Justine, and I'm going to give you a speech on obsessive compulsive disorder. Everybody worries sometimes, but what happens if you're one of the estimated 3.3 million Americans that suffer from recurrent thoughts and unwanted thoughts or rituals which they feel they cannot control, that interfere with their daily lives? Obsessive compulsive disorder is a mental disease that has the capabilities of debilitating one's lifestyle, financially, mentally, and personally. Today we will discuss obsessive compulsive disorder. First we'll talk about what is obsessive compulsive disorder, obsessions and compulsions, and finally the treatment options. Much of the information today I gathered from understanding OCD. What is OCD? OCD stands for obsessive compulsive disorder. OCD affects approximately 2.3% of Americans. It begins in early childhood and affects men and women equally. OCD is a debilitating anxiety disorder where one has unreasonable thoughts and fears that lead to repetitive behaviors, otherwise known as obsessions and compulsions. What are obsessions and compulsions, you might ask? Obsessions are unwanted thoughts, recurring images, or impulsions that persist, and compulsions are repetitive behaviors. Often, these are strict rituals that are intended to suppress anxiety caused by the obsessions. Obsessions follow common themes. One common theme is contamination. People who have obsessions of contamination fear dirt and germs. Their compulsion can be repetitive hand washing, showering, as well as cleaning of their home when it doesn't even show evidence of being dirty. One common thing in obsessive compulsive is washing their hands until they crack and bleed. Another obsession is saving and collecting, also known as hoarding. I'm sure you guys have all seen hoarding on TV or Buried Alive. This results in collecting of useless items and the need to save household trash that may be valuable. There's also concerning with order. The need to have everything just right. Their compulsion to have symmetry and total order around them. Other compulsive themes can be obsessions with food and weight. So a lot of people with eating disorders can have OCD as well. Religion and superstitious beliefs. They get stuck on a number. They feel that if they don't turn the light switch on 3 or 4 times that something bad can happen to them. Or if they see a color that's a bad thing for them, and they'll have to do a ritual to correct that. Obsessive compulsive disorder is a long-term illness, and if left untreated, obsessions and compulsions may begin to consume their lives. One might ask how obsessive compulsive disorder is treated. It might seem that it would be a hard disorder to treat, and that the fact is that it is a hard disorder to treat because it is a long-term disease, and the patient inflicted with OCD has to have long-term treatment. There are 2 treatments for OCD. One is medication, and the other is cognitive behavioral therapy. And cognitive behavioral therapy is exposing the sufferer to the obsession and teaching them ways to cope with it. So if their obsession is to turn on and off the light switch 3 times, it's to teach them to do it once, and that it's okay, that nothing bad is going to happen. With medication therapy, the most commonly used is antidepressants because they increase serotonin levels, which can be lacking in patients with OCD. For those with severe OCD, there are other treatment options. Psychiatric hospitalization, residential treatments, electroconvulsion therapy, and deep range stimulation. OCD is a very real and serious mental illness that affects a large number of American population. Throughout treatment and such medications and therapy, the American Medical Association and physician members are combating the issue at a steady, fast diligence.
Yeah, I'm going to